NCSBN-NCLEX RN Test Bank 800 Questions and Answers Latest Newest Prep. Question 1. Why is it essential for the nurse to be alert to cardinal signs of pregnancy-induced hypertension? Option A. Mild hypertension is treated with various medications. Option B. Emotional stress is the primary cause. Option C. Self-discipline is required for caloric control. Option D. The client may not recognize the early symptoms. The correct answer is option D. The client may not recognize the early symptoms. Clients frequently do not recognize the subtle early signs and symptoms of mild pregnancy-induced hypertension. Question 2. Which blood pressure change should be of greatest concern to the nurse in a prenatal client? Option A. 130/88 to 144/92. Option B. 136/90 to 148/100. Option C. 150/96 to 160/104. Option D. 118/70 to 130/88. The correct answer is option D. 118/70 to 130/88. The change from 118/70 to 130/88 represents the most significant increase, indicating early hypertensive complications. Question 3. The weight gain of 14 pounds in 1 month for a prenatal client with pregnancy-induced hypertension is most likely due to? Option A. Overeating. Option B. Obesity prior to conception. Option C. Hypertension from kidney lesions. Option D. Fluid retention. The correct answer is option D. Fluid retention. Weight gain in pregnancy-induced hypertension is primarily caused by the retention of sodium ions in fluid. Question 4. The nurse knows that the anticipated effects of magnesium sulfate therapy for pregnancy-induced hypertension are anticonvulsant and? Option A. Vasoconstrictive. Option B. Vasodilative. Option C. Hypertensive. Option D. Antiemetic. The correct answer is option B. Vasodilative. Magnesium sulfate acts as a central nervous system depressant and provides vasodilation to lower blood pressure. Question 5. A nurse should monitor a client for which side effect of magnesium sulfate? Option A. Visual blurring. Option B. Tachypnea. Option C. Epigastric pain. Option D. Respiratory depression. The correct answer is option D. Respiratory depression. Respiratory depression is a common sign of magnesium toxicity and must be monitored frequently. Question 6. What is the antidote for magnesium sulfate side effects or toxicity? Option A. Magnesium oxide. Option B. Calcium hydroxide. Option C. Calcium gluconate. Option D. Naloxone. The correct answer is option C. Calcium gluconate. Calcium gluconate is the standard antidote for magnesium toxicity and should be readily available. Question 7. A client with severe pregnancy-induced hypertension is placed in a quiet, darkened room. Why? Option A. The client is restless. Option B. Elevated blood pressure causes photophobia. Option C. Noise or light may precipitate a convulsion. Option D. External stimuli are annoying. The correct answer is option C. Noise or light may precipitate a convulsion. A quiet, darkened room minimizes external sensory stimuli and reduces the risk of precipitating a convulsion. Question 8. A nurse is caring for a client in the first stage of labor. The nurse should instruct her. Option A. To hold her breath during contractions. Option B. To stay flat on her back. Option C. Not to push with her contractions. Option D. To push before becoming fully dilated. The correct answer is option C. Not to push with her contractions. The client should only push during the second stage of labor when the cervix is fully dilated. Question 9. In the event of a prolapsed umbilical cord, what is an appropriate nursing measure? Option A. Pour sterile saline on cord every 15 minutes. Option B. Cover the cord with a wet sponge. Option C. Apply a cord clamp to the exposed cord. Option D. Keep the cord warm and moist with warm sterile saline compresses. The correct answer is option D. Keep the cord warm and moist with warm sterile saline compresses. The cord should be kept warm and moist to maintain fetal circulation until delivery can occur. Question 10. Which of the following signs might indicate a complication during labor with a vertex presentation? Option A, a fetal tachycardia to 170. Option B, nausea and vomiting at transition. Option C, a contraction lasting 60 seconds. Option D, appearance of dark-colored amniotic fluid. The correct answer is option D, appearance of dark-colored amniotic fluid. The passage of meconium in a vertex presentation is an ominous sign of fetal distress. Question 11. A client in labor has contractions lasting 70 seconds and is only 3 centimeters dilated. What is the first nursing intervention? Option A, check fetal heart tones. Option B, notify the attending physician. Option C, turn off the intravenous oxytocin. Option D, prepare for delivery. The correct answer is option C, turn off the intravenous oxytocin. Oxytocin-induced contractions lasting 70 seconds in the latent phase are considered excessive and the infusion should be stopped to prevent uterine rupture. Question 12. A postpartum client fundus is found laterally to the umbilicus. This is most likely due to option A, endometritis. Option B, fibroid tumor. Option C, displacement due to bowel distension. Option D, urine retention or distended bladder. The correct answer is option D, urine retention or distended bladder. A full bladder commonly displaces the uterus laterally and may delay involution. Question 13. Which of the following postpartum symptoms would warrant further nursing intervention? Option A, a pulse rate of 60 beats per minute. Option B, diuresis on the third day. Option C, return of rubra after the serosa period. Option D, diaphoresis by the third day. The correct answer is option C, return of rubra after the serosa period. The return of red lochia after the serosa period has passed may indicate a secondary hemorrhage or other postpartal complication. Question 14. A postpartum client complains of rectal pressure and severe pain in her perineum. This may be indicative of option A, afterbirth pains. Option B, constipation. Option C, cystitis. Option D, hematoma of the vagina or vulva. The correct answer is option D, hematoma of the vagina or vulva. A hematoma in the perineal or vaginal area often presents as severe pain and pressure. Question 15. A 10-year-old with diabetes hates broccoli and wants corn. What is the nurse's appropriate response? Option A, no vegetable exchanges are allowed. Option B, corn and starchy vegetables are considered bread exchanges. Option C, yes, you may exchange any vegetable for any other. Option D, yes, but only 1/2 ear is allowed. The correct answer is option B. Corn and starchy vegetables are considered bread exchanges. Starchy vegetables are high in carbohydrates and are counted as bread or starch exchanges in diabetic meal planning. Question 16. Which of the following must be taught to a 10-year-old administering insulin? Option A, never use the abdominal site. Option B, pinch the skin to form a subcutaneous pocket. Option C, avoid applying pressure after injection. Option D, change needles after every injection. The correct answer is option B, pinch the skin to form a subcutaneous pocket. The pinch technique creates skin tension to allow for the easy entrance of the needle into the subcutaneous layer. Question 17. What stool assessment would the nurse expect in a child with cystic fibrosis? Option A, clay-colored. Option B, steatorrhea. Option C, dark brown. Option D, blood-tinged. The correct answer is option B, steatorrhea. In cystic fibrosis, fat absorption is impaired, leading to foul, frothy, bulky stools known as steatorrhea. Question 18. What is the most widely used screening test for preschool children? Option A, revised pre-screening developmental questionnaire. Option B, good enough draw a person test. Option C, Denver developmental screening test. Option D, Caldwell home inventory. The correct answer is option C, Denver developmental screening test. The Denver Developmental Screening Test is widely used due to its reliability and systematic approach to assessing preschool children. Question 19. How should the nurse teach the mother of a 17-month-old to implement toilet training? Option A. Take favorite toys with the child. Option B. Have a child-sized toilet seat available. Option C. Use medical terms like void and defecate. Option D. Show disapproval if unsuccessful. The correct answer is option B. Have a child-sized toilet seat available. A child-sized toilet seat provides the toddler with a necessary sense of security during the training process. Question 20. What is an appropriate toy suggestion for a 17-month-old child? Option A. A pull toy. Option B. A mobile. Option C. Large toy with movable parts. Option D. Large colored blocks. The correct answer is option A. A pull toy. Pull toys are highly recommended for toddlers as they encourage movement and capitalize on their growing locomotive skills. Question 21. How does the nurse evaluate the effectiveness of epinephrine in an asthmatic child? Option A. Increased pulse rate. Option B. Increased expectorate of secretions. Option C. Decreased inspiratory difficulty. Option D. Increased respiratory rate. The correct answer is option C. Decreased inspiratory difficulty. Epinephrine causes sympathomimetic stimulation leading to bronchodilation, which decreases inspiratory difficulty. Question 22. What is the primary cause of respiratory alteration in a 16-year-old asthmatic? Option A. Altered surfactant production. Option B. Paradoxical chest movements. Option C. Increased airway resistance. Option D. Continuous changes in rate and depth. The correct answer is option C. Increased airway resistance. Asthma involves spasm and constriction of the airway, resulting in significantly increased resistance to airflow. Question 23. A mother calls about her child eating pills. What is the initial action? Option A. Give syrup of Ipecac. Option B. Give syrup of Ipecac with water. Option C. Give 1 cup of water. Option D. Bring child to the emergency room. The correct answer is option D. Bring child to the emergency room. Vomiting should never be induced until the substance is known and the child is assessed in an emergency setting. Question 24. What is the most appropriate nursing action for an unconscious child with an aspirin overdose? Option A. Nasogastric lavage. Option B. Monitor muscle status. Option C. Teach poison prevention. Option D. Place child on respiratory assistance. The correct answer is option A. Nasogastric lavage. The priority treatment for a known overdose is to remove the drug via forced emesis or gastric lavage. Question 25. Why should tetracycline be avoided in children younger than 8? Option A. Permanent staining of teeth. Option B. It is readily absorbed with milk. Option C. It is meant only for adults. Option D. Secondary infections do not respond to antibiotics. The correct answer is option A. Permanent staining of teeth. Tetracycline interferes with enamel formation and dental pigmentation during tooth development. Question 26. Which behavior in a failure to thrive infant might indicate maternal deprivation? Option A. Irresponsive to touch. Option B. Uncomforted by touch and refuses bottle. Option C. Maintains eye contact. Option D. A finicky eater but cuddly. The correct answer is option B. Uncomforted by touch and refuses bottle. Maternal deprivation in infants often presents as poor feeding, refusal to eat, and displeasure with physical contact. Question 27. A mother states she is not producing enough milk. What is the nurse's advice? Option A. Start solid food. Option B. Nurse the child more frequently. Option C. Provide supplements between breastfeedings. Option D. Wait 4 hours between feedings. The correct answer is option B. Nurse the child more frequently. Milk production operates on supply and demand, so frequent nursing during a growth spurt increases supply. Question 28. What is the recommended home care for an infant with gastroesophageal reflux? Option A. Lay infant flat on side. Option B. Feed every 4 hours. Option C. Give antacids an hour before feeding. Option D. Play activities before feedings. The correct answer is option D. Play activities before feedings. Infants should be kept still after feedings to reduce reflux risk, while vigorous activities should occur before feeding. Question 29. What is the appropriate way to explain a painful procedure to a 6-year-old? Option A. Some say this feels like a pinch. Option B. This will hurt a lot. Option C. This is a terrible procedure. Option D. This will hurt only a little. The correct answer is option A. Some say this feels like a pinch. Allowing the child to have their own perception while avoiding suggestions of pain is the most effective approach. Question 30. What is the most appropriate action if a child has a grand mal seizure in the playroom? Option A. Place a tongue blade in the mouth. Option B. Restrain the child. Option C. Go to the station to call for help. Option D. Move furniture and place a blanket under head. The correct answer is option D. Move furniture and place a blanket under head. The priority is to provide a safe environment for the child and protect them from injury during the seizure. Question 31. How is ribavirin administered for the treatment of respiratory syncytial virus? Option A. Oral. Option B. Intramuscular. Option C. Intravenous. Option D. Aerosol. The correct answer is option D. Aerosol. Ribavirin is reconstituted and aerosolized for delivery via mask or oxygen hood. Question 32. When monitoring a child 48 hours after a major thermal burn, what complication is most expected? Option A. A fluid volume deficit. Option B. Fluid volume excess. Option C. Decreased cardiac output. Option D. Severe hypotension. The correct answer is option B. Fluid volume excess. After fluid resuscitation, interstitial fluid returns rapidly to the vascular compartment, requiring monitoring for fluid overload. Question 33. Which of the following is a reliable indicator for assessing fluid resuscitation in a burn child? Option A. Blood pressure. Option B. Level of consciousness. Option C. Skin turgor. Option D. Fluid intake. The correct answer is option B. Level of consciousness. Alterations in sensorium combined with urine output and capillary refill are the most reliable indicators of fluid adequacy. Question 34. What is the correct home treatment for a child with croup? Option A. Hot water in the bathroom. Option B. Antihistamine. Option C. Clear liquids if drooling occurs. Option D. Cool mist vaporizer and encourage crying. The correct answer is option A. Hot water in the bathroom. A cool mist environment helps to liquefy and mobilize secretions in the child with croup. Question 35. A 7-year-old child has drooling, absence of cough, and agitation. What is the suspected diagnosis? Option A. Acute tracheitis. Option B. Acute spasmodic croup. Option C. Acute epiglottitis. Option D. Acute laryngotracheobronchitis. The correct answer is option C. Acute epiglottitis. Drooling, absence of cough, and agitation are the classic clinical triad for epiglottitis. Question 36. What is a non-pharmacological technique for relieving itching under a spica cast? Option A. Blowing air with cool hairdryer. Option B. Slide a ruler to scratch. Option C. Towels under the cast. Option D. Thumping the cast. The correct answer is option A. Blowing air with cool hairdryer. Cool air from a hairdryer is effective for pruritus without damaging the skin or the cast material. Question 37. A domestic violence victim expresses fear and helplessness. What is the best response? Option A. I would not go home, call a friend. Option B. Did you do something to make him angry? Option C. Let us talk about resources so you do not have to go home. Option D. I will call the police and you can rest. The correct answer is option C. Let us talk about resources so you do not have to go home. The nurse should offer alternatives and assistance in finding resources for the client in crisis. Question 38. A client with aprazolam abuse continues to have anxiety. How is successful coping evaluated? Option A, client promises not to abuse the drug. Option B, client demonstrates use of physical activity to handle stress. Option C, client verbalizes the effects of abuse. Option D, client remains substance-free during hospitalization. The correct answer is option B. Client demonstrates use of physical activity to handle stress. Demonstrating healthy stress reduction techniques indicates the client has developed effective alternative coping strategies. Question 39. An angry borderline client demands special privileges and shouts. What is the appropriate response? Option A, place in seclusion. Option B, touch the client to get attention. Option C, offer a one-to-one session in a quiet area. Option D, confront and state consequences. The correct answer is option C. Offer a one-to-one session in a quiet area. Offering a quiet session assists the client in regaining control without escalating the situation. Question 40. A client in total despair feels hopeless, worthless, and has a flat affect. What depression level is this? Option A, transient. Option B, mild. Option C, moderate. Option D, severe. The correct answer is option D, severe. Severe depression is characterized by total despair, hopelessness, emptiness, and potential delusional thinking. Question 41. What is a strategy to help a depressed client focus on strengths? Option A, tell her to attend all activities. Option B, encourage activities that offer simple success. Option C, direct her to make all unit decisions. Option D, do not allow dependent behaviors. The correct answer is option B. Encourage activities that offer simple success. Focusing on strengths and simple accomplishments minimizes failure and increases self-worth in depressed clients. Question 42. A client says, I just could not take it anymore after a suicide attempt. What is the best response? Option A. You should not do things like that. Option B. Tell me more about what you could not take. Option C. I am sure you did not mean to kill yourself. Option D. How long have you been in the hospital? The correct answer is option B. Tell me more about what you could not take. Broad openings like this encourage the client to continue verbalizing and exploring their feelings. Question 43. What should the nurse do for a manic client who will not sit for meals? Option A, insist she sit down. Option B, discuss the importance of nutrition. Option C, allow snacks and drinks anytime. Option D, monitor intake and offer frequent snacks and juice. The correct answer is option D. Monitor intake and offer frequent snacks and juice. Manic clients move constantly, so providing high-energy finger foods and monitoring intake is the most effective strategy. Question 44. What is the highest priority for a severely depressed client? Option A, nutritional status. Option B, impaired thinking. Option C, possible harm to self. Option D, rest and activity impairment. The correct answer is option C, possible harm to self. Safety and the prevention of harm to self are always the highest priority in psychiatric care.